caught my hair this morning.
So,
Okay.
this is Dr. Lisa Fitzgerald. She can put on her glass. Fitzgerald.
Fitzpatrick.
Fitzpatrick.
was
Man, I've been
way
calling
off.
you the wrong thing for so long.
You've been
Wow.
at least, well, that's a good thing you're tagging me instead of.
Man. This is Dr. Lisa Fitzpatrick.
Yes.
She does many things here awesome for the Department of Health here in DC. And so I'm going to let her introduce herself formally so we get her name right.
Okay. Well, who is this for?
Just the internet.
Hello, Internet. I'm Dr. Lisa Fitzpatrick. I'm a physician trained in infectious diseases, but I also am a public health expert. I trained in public health at the Centers for Disease Control in Atlanta, Georgia, and have held many positions across the health sector. My most recent job was as medical director for the DC Medicaid program. And now I am a budding entrepreneur who's very interested in digital health in low-income communities and health literacy. My passion is helping people understand health information and how to use and access the healthcare system.
Awesome. I love it. You're a physician and an entrepreneur.
Yes, we are rare birds.
You're rare birds indeed. So, Dr. Lisa doesn't know that we only get one take. I'm going to ask you some questions. Doesn't matter if there's a siren in the background. So why did you decide to go from a physician to an entrepreneur?
Well, I didn't necessarily go from physician to entrepreneur. I am a physician entrepreneur. So, and the reason I'm making a distinction is because it's still very important to me to see patients, because that's where I begin to understand what the real issues are. And then I want to take that information that I'm getting directly from patients who will become my end users and turn that into some incredible innovation that will help them improve their lives and improve the value of the healthcare they're getting. And I made the switch because it was frustrating being a doctor, seeing the problems, and not really being able to address the problems. Even in some of my jobs, I've had very good jobs where I'm in positions of authority, but there's a limit to what you can do to help people. So I decided I wanted to take all of this information I've gathered across my career for the last 20 years and see how I could use that to help people in a different way. And so that's where the entrepreneurship innovation comes in. And I'm an idea person. I've always been an idea person. From the time I wake up in the morning to the time I go to bed at night, oh, that's a good idea, that's a good idea. So I think I've always been an entrepreneur, and I just didn't know it. So I didn't really switch from physician to entrepreneur. I'm creating, even in my clinics, I was thinking of ways to change the way we deliver healthcare, the way we operate in our clinics, and so on. And it took a while for me to figure out why I always felt different.
What do you mean by why you feel different?
As a clinician, people might say, well, they would notice that I was always looking for ways to improve things, or I was not okay with the status quo, or I was, this term disruption is a fairly new term, I would say, but I think that's how people were describing me. Like, why are you always turning things over and upsetting the apple cart? And that's kind of the person I was in the healthcare system, whether it was in the hospital or in my clinic, just looking for ways to improve the way we deliver healthcare. And so, it's been interesting. I feel like a foreign body in most organizations. And you know what happens when there's a foreign body in your body?
Your white blood cells and phagocytes eat you.
They want to spit you out, right? So if you have a foreign body, it's eventually going to expulse itself. And that's generally what happens to me in organizations. Eventually, they spit me out, or I find a way to push myself out. So
excellent.
Yeah.
I am a big fan of automating oneself out of a job, because that's a process. It means you're actually doing what you're there for, to accomplish a goal or a mission, and to streamline and create efficiencies. That way you've mentored and brought people up behind you, so that at the point you're like, well, I don't actually need to be here anymore.
Yeah.
I try to tell people, if you're the only person who can do your job, I am going to fire you myself because you create a single point of failure and you haven't been mentoring the next generation of awesomeness.
Yeah,
So-
that is so true, and I would love to put myself out of a job. I would love to have a day where prevention ruled and we didn't have to take care of sick people with preventable illnesses.
No, that's awesome. So we're at our 5-minute mark. I know it goes by super quick,
Okay.
but tell people where they can find you on LinkedIn or the Instagrams or internet.
On Instagram and Twitter, I'm at Ask Dr. Fitz. I have a Facebook page, also Ask Dr. Fitz, or Promoting Practical Health, which is also the name of my company, which you can find on the internet, promotingpracticalhealth.org.
Excellent. And is there, as a physician, is there anything that you have a specialty in?
My specialty is in public health and infectious diseases, but my passion and what I'm focused on now is health literacy, helping people understand how to use health information and interact with the healthcare system.
Brilliant. Thank you very much for letting me do a impromptu pull out the camera.
Yeah. Thanks so much.
Talk to you later. Bye-bye.
Okay.